Hi, and welcome to our Instagram Live and Facebook Live. It's November 19th, and you know what that is? That's my brother's birthday. So happy birthday, Paul. Love you. Gosh, time flies. So my brother and I are about 5 years apart, and we grew up together, obviously. He's a young man I'm very proud of. So cheers to you, buddy. Today we're going to talk about no's, no-nos. But before that, I'm going to talk to you about a couple of new people on our team. So we have 2 part-time skincare specialists, estheticians, on board, and they're here part-time. The younger lady's name is Catherine, and she's very nice, very easy to work with. She's very passionate about skin. Sun is the other lady, and she has very experienced in skincare, especially of all types. So whether it's Caucasian skin, Asian, Latino, African American skin, she's very experienced in all of those branches. So call our office 703-705-2100 to meet with them. And we have an express facial deal going on right now, which is originally valued at $60 for $39, booked for a limited time only. Very happy to bring these skincare experts. I trained in surgery, and while skin is a very important part of your appearance, it's something that these ladies are much more focused on. So I'm glad to bring them on board, and I'm happy to offer their services for our wonderful patients. So we have a holiday party coming up. It'll be the second Wednesday of next month. We're going to have some flash deals, as well as meet our skincare specialists and chat with me and our staff and enjoy some hors d'oeuvres. And we're going to have our rep from Allergan. Her name is Julie. She is the one who supplies Botox and Juvederm fillers. So any questions you have for her, we can have you meet with her to address your questions then at that time as well. I might also be bringing my violin, so please be on the lookout for that. All right, so the first no-no for your nose. Last week we talked about 2 ways that you can change the shape of your nose: filler and surgery. So today we're going to talk about the 2 ways that you should not change the shape of your nose. And the first one is nose thread lifting. Okay, you might have seen this on Google or YouTube, and threads are used in aesthetic medicine for basically inserting under the skin, and as you pull out, it lifts or pulls your skin and tissue in a certain direction. So for cheeks and for saggy jawlines, what some people do is they insert thread through here towards the middle part of your face, and as the thread is inserted, basically what it does is it does a little bit of this. Okay, you see a lot of results for 1 week, 1 month, but if you look at people's social media, if you look at before and afters, no matter where they come from, generally you don't have long-term follow-up. So in essence, threads for any part of the face don't last very long. And that's the take-home message, is that if you want a very short-term change for your nose with a little bit of point, thread lift might be an option for you. But if you want a decent long-term change, it's not for you. Not to mention that, yes, this is a quick and easy procedure in the office, but there are, this procedure is not without some risk. So threads are basically barbed wire, and as they are inserted into the tissue, the barbs kind of grab at inside your tissue. And as the threads are inserted, it moves your tissue in a certain direction, right? So these tissue under your nose, under the skin of your nose, is very delicate, and so you have to deal with it very gently. I know this because as a rhinoplasty surgeon, I've done this hundreds of times. So in terms of scarring the nose tissue with a thread or barbed wire basically, you're undermining the tissue integrity, okay? So while this may give you a good instant result, it won't last long, and also it'll produce unnecessary scar tissue in your nose for the next time that you want to change the shape of your nose. And as a rhinoplasty surgeon, I know that every time you do something to your nose, it makes the subsequent procedure harder, okay? Whether it's filler, and especially if it's surgery, the subsequent procedures are oftentimes multiple fold harder, okay? So threads, definitely don't do them, okay? Whether it's for your face or for your nose, because number one, it won't last very long, and number two, there's consequences to the tissue and the scar formation inside your nose, okay? What's the second no-no? This, implants, okay? So rhinoplasty surgery is a very tough operation in that you want to make the center of your face look as best as possible, right? Now, the other thing that you don't want, the other goal that you want to achieve is to have a long-lasting result where things don't move around over time. I've seen plenty of people like this where the implant has moved either up, down, or out of the skin, okay? And as you can see, this young guy, he actually went to the emergency room because this nasal implant started to poke out his skin, okay? And what does that do? That harms your self-confidence. You are reminded of it every time you look in the mirror, right? This guy's a handsome guy. I mean, we blacked out his eyes for privacy purposes, but he's a very handsome guy. He was walking around with a piece of artificial material sticking out his nose. That of course hampered your confidence, okay? So I took the thing out in the office, okay? I injected numbing medicine along here, and basically it more or less, you know, we shimmied it out slowly, but we got it out relatively atraumatically. And so we go from this to that, okay? As you can see, the nose kind of comes down because we've removed an implant from the top of his nose, but aesthetically it's a fine nose, okay? These implants were very popular since, gosh, the 60s, 70s, especially, you know, a lot of my patients, you know, they got theirs 20, 30 years ago, so 80s, 90s, and the appeal of it is that it's a very quick procedure, okay? You can actually do this without general anesthesia, putting in an implant for your nose. And, you know, you make an incision just inside your nostril, and you make a little tunnel, and you put in the implant, you know, and then you shape the implant according to the proper size and height so that you get a nice nose bridge. That's great, and, you know, for all I know, there's a good amount of times where you do this once and there's no trouble and you live with it for the rest of your life, great. But for the times where the implant starts to move, where it starts to extrude, which means poke out the skin, or it gets infected, it's a really tough battle to fix that, okay? So each week there are a handful of patients who come to the office saying, hey, I got this implant, you know, some as recently as like a year ago, but even some as long as 30, 40 years ago, who say, hey, I don't like how this looks anymore, either it migrated or either it looks artificial to me now, and I want it gone, okay? So yes, I do offer them the procedure to remove the implant and to replace it with your own cartilage, which we talked about in last month's live. Okay, with rhinoplasty surgery for Asian people, generally the goal is to make the nose bigger and more pointier. Sorry, grammatical error. But you get the idea that you have to get cartilage from somewhere else, either inside your nose, from the ear bowl, or from the rib. Okay. For Asian patients, the cartilage inside your nose is not abundant or strong enough. Okay, and the cartilage in your ear bowl is too flexible. So to get the appropriate amount of height for the nose and for the tip, you often need cartilage from the rib. Okay, so that's what I would recommend in lieu of implants. Okay, implants are a quick procedure. You can do it under local anesthesia. Okay, you may get away with not having any problems, but the long and the short of it is that if you do, it's a real pain in the neck to fix. Okay, so I would strongly recommend against implants and strongly recommend against threads. Okay, these are both quick procedures that can be done in the office, but the better alternative is an investment of your day at the surgery center, having a proper rhinoplasty with your own cartilage. Okay, if you want a trial, nose with filler, that's a good option too. Okay, there have been recent articles from people in my field saying that the liquid rhinoplasty or the injection rhinoplasty is going to fall out of favor. And one of the reasons why is that oftentimes in order to camouflage your hump, you need to add a lot more here. Now, if you add more at the top of your nose to the point where it blends in with your forehead, that's not a good look. You look like an avatar. So what I've been doing in terms of my injection rhinoplasties is that I've been doing just enough right up here at the top of the bridge of the nose where you still have a forehead contour, okay? This is called the nasofrontal angle, which because it's made out of your nasal bones and your frontal bones, and if you blunt that too much, it's not good. It's not a good look. So I've been going a little less along the dorsum, along the top of the dorsum, and actually accentuating the tip a little more, and that turns out to be a pretty good result. So I'll leave the content at that, and if there are any questions, we have time for that as well.
We do have some questions, Dr. Kim. One person asked, I have a nose implant. What are the chances of it being like the guy in the picture?
So the guy in the picture is probably the exception. Okay, more commonly the implant is prone to perhaps moving around. Okay, for some people, when I examine their nose, I'll do this to their tip, and the implant will move like this. So actually, number one, it's in the wrong tissue plane. Number two, it's subject to movement. So if you can feel it and move it, it's not a good look. But this, frank extrusion of an implant, among the patients I see with problems with their implants, probably about 10% of them.
Great. Another person asked, what if I already have a nose thread lift, but I want to go for surgery? How can I get rid of the thread?
So the best thing to do when it comes to threads is actually wait. Threads do melt away, so give it 6 months, most likely some may last up to a year. And after the appropriate amount of time has passed, then you can have a consultation to talk about what your rhinoplasty goals are. In terms of the amount of scarring that it results from thread lifting for your nose, there is a small amount of scarring, okay, but overall it shouldn't hamper the rhinoplasty results significantly.
Okay, I don't think there's any more questions, Dr. Kim. Can you tell us about your Thanksgiving plans?
For Thanksgiving, we're going up to New York, where my wife and I grew up. We're going to see our families. We're going to have a big turkey and stuffing, obviously. Also, both sets of parents are celebrating their 40th wedding anniversary this year, so we're going to celebrate them for bringing us into the world and for being great parents to us. So we really appreciate that. Speaking of Thanksgiving, I'm thankful for my family, my friends, my patients, my awesome staff, for my dog Nala. So I really appreciate you guys. We are actually coming up on 2 years since we saw our first patient here in the Fairfax office, so we're really grateful for you continuing to support the office and my staff. And for Nala, so from all my team to you guys, happy Thanksgiving. Hope to see you at the holiday party on December 8th, and please take the time to meet with me and also our estheticians. The estheticians are great skincare professionals, and we're open to topics for the December live. So any topics you would like me to discuss, please send them DM, comment. You can text our office, and we look forward to seeing you next time. All right, happy Thanksgiving. Take care.